Guru Nation, this is a very important. Monica Quitiva, Save Our Sites co-founder, Latinos in Clinical Research co-founder, Clarity Clinical Research co-founder, and Monday.com expert. Did I miss? I probably missed some stuff. Oh, CRC
The
Academy,
the
the
University of Clinical
university.
Research, and more to
Okay.
come.
So, you watched, like many others that are the core Darshan live stream with me about the economy with Trump and
Yes.
tariffs, and I posted a meme about how Trump is horrible for the stock market, like Ozempic for Trumpaglutide, I think, and you'll lose 17%, and it was more today, by the way. The market was horrible today, and tomorrow looks like more. So he's not backing down. This is not political, first of all.
Exactly. So we're going to talk about economy rather
Yeah,
than
we're going to talk
political.
about the what's happening to the economy because it's very volatile,
Yeah.
and to say the least. And
Hmm.
the takeaway message from my interview with Darshan was if we get some kind of a resolution soon, either Trump says, we won the the negotiations, we're gonna go, we have like reciprocal tariffs, not these nuclear tariffs he's doing. I think the market recovers, everything's fine. But if this drags on for months, there's a risk of study pipelines just stopping until there's more funding in the markets. I mean, you can't drain this much liquidity from the markets and not expect some kind of consequence, no matter how rich the company is. It's draining money out of the economy the longer this goes on. Even Trump would be the one to tell you that. So, what do people do if they find themselves in a situation where either they lost their job, because there's already a lot of people, it wouldn't even have to be hypothetical. They lost their jobs, but then people are on the fence and maybe they will lose their jobs, or maybe they were about to get hired, but they won't now for a little longer until there's some clarity in the market. No pun intended with your site. But what do you think is the advice?
And and then we also have the sites, right? The
Yeah.
sites with I mean, thinking if the business are going to continue or not.
Yes.
So first of all, in regards to economy, is one of my favorite topics. I listen to economy and financial podcasts basically every day, and it's
You
not
love
just
this
now.
stuff.
It has been
Do
always
you like
my
this more than
my thing.
Raul, the economy? Or is Raul into it more than you? Or
No, I mean, I have always been very into it. I think I'm more than Raul is.
I think so too. I think so too.
Is one of my favorite topic. I don't know, since I was in university, it became one of my favorite
You
topics.
love this stuff.
So I do
And
love
you're always texting
economy.
me
Yeah,
stuff, and I'm always like, wow, you know, the market, what's gonna happen?
exactly. I mean, even so, putting political aside, the economy has always their elasticity, right? That ups and downs and how everything works and is part of the economy. Even I mean, a healthy economy have the ups and downs, right? It cannot
Yeah.
be just always up or always down. But with many of the stuff that has happened in the past, and it has been just accumulating, right? So we were going to, it was just like a that game, that the hot potato, right? One president was passing it to the other one until in some point it's going to explode. So every single president has done their to the best of their abilities what they could do to improve the economy, right? So and every single one has a different approach. And exactly like I mentioned, I don't want to be political, but if we think about it, Trump is a business that has the business perspective that maybe other presidents didn't have. So just taking it from that perspective, naturally, he will, and I mean, besides being a business person, he's also has been an also a serial entrepreneur, right? So he knows the what it takes to improve the business perspective. Um, and again, I want to mention this. I'm not pro or in con, right? I don't
Monica,
want.
I've been doing this for a
I
while.
don't. I don't.
There's
I don't.
ultimately no way to avoid it.
Yes,
I've been highly critical of his tariff stance. I think it's nuclear. I think it's his ego getting in the way. I know others say there's like a strategy. I don't think so. I think he overplayed his cards and doesn't want to back down. But I'm not critical of Doge and the efficiencies that they're trying to do, even when it comes to the NIH. Maybe they went a little too far, but compared to what we had before, and I'm public about this with Darshan. So I'm pretty neutral, like where I think I'm neutral on this. I'm not pro or against. I go by what I see, and in this case, I'm seeing a little too much bullying going on the side of Trump. Although his proponents say, well, he's playing the long game, and this is the art of the deal, and blah blah blah. So
exactly. And
that
if you think about it, he also has been on different shows where he's a showman too. So this is part of his
it's
personality,
part of it, but
right?
man, it
Exactly.
hurts when there's people
I
losing
think
money.
it is affecting, but hoping for the best, right? I'm not sure.
Yeah.
I mean, I think it's gonna work at the end of the day because, like I say, thinking historically on his personality, how things has been with the economy and the way he negotiates, which is very aggressive, and at the same time his personality is also very strong. He's been talking about tariffs since
Oh yeah.
1988.
He's very
So
consistent
it's
on
not
that.
it's
Yeah.
so he I'm thinking he's savvy on that regards, right?
But the
we're not
criticism
gonna
I
we're,
have
we're not
is
gonna
these are no longer reciprocal tariffs. That's what he's been calling for. It's beyond that now. Now it's like if you don't do what we want, we're gonna do more, and then China came back and selling treasuries. So this is gonna take, it looks like right now it's gonna go longer than we would like. And so if that's the case, it may mean a steady slowdown
yeah.
next year, maybe.
So what I think the way I think it might affect, obviously, and it's gonna start affecting maybe even starting this summer, like Darshan was mentioning. And the reason why is because of the supply chain, right? So that's the main thing that is gonna start affecting everything else. As it is, my husband works also with medical equipment, and he has seen some sort of negative effect when it comes to transportation, because a lot of the people that work in transportation have been affected by the immigration
Yep.
stuff,
Yep.
and so we're gonna see adjustments. And
Yeah.
when everything gets adjusted, when everything gets like in a turmoil, it's uncomfortable until everything settles. So we're gonna see the results of all of this soon, right? What I think about our industry, how it's going to affect is, like I was mentioning, on the because of the supply chain. Obviously, everything is going to increase. For the pharmaceutical companies, this is going to affect in a way that, um, obviously, the products are going to need to get increase in the cost. United States is still being the highest producer of drugs in the world. I mean, medications, treatments in the world, and and that's on our benefit, right? But then at the same time, it's also against us because of the supply chain. Now, if we think about the clinical research part of the process, even that research is not sales, but it's an investment. They are still going to have to invest more because of the supplies, but then at the same time, they will want to even out this kind of business, the when it comes of the investments. So what I think that it might happen is that they are going to start looking into markets where the clinical research is going to be less costly. So they might start doing phase ones overseas in countries that the
They're already doing
regulatory are
Australia.
similar.
They're already doing
Exactly.
Australia.
Where the regulations are similar. And in fact, I think the countries that they are going to start looking is going to be India, Latin America, maybe Poland, and obviously, yeah, Australia, as you mentioned. Um,
Already doing it in
Brazil,
Australia.
Brazil, Mexico, Colombia, Philippines, and Thailand. Some parts of South Africa. Those are the countries where it might be similar in regulations, similar, but not the same, right? Now, when it comes to that, because it's gonna make it cheaper, and thinking about the the politics or the environment that we are now, if the president is trying to bring everything home, they might put the guidelines or the rules or the guidelines more strict with the FDA. So they put, in order to get approved, this data is gonna be a lot more difficult. So they will put the pharmaceutical companies like in a situation where they have to invest a little bit more maybe overseas, um, but it's
Yeah,
still getting it lower.
but I
But
think
then
they
at
were
the same
already
time,
doing that. They were already like even way before tariffs. I wrote this
yeah,
article about outsourcing
yes,
in Latin America, and that
yes,
was
I remember
already
that.
in the
Yeah, I
works.
remember that. I remember that. But I think FDA guidelines are going to become more stringent. So
Ah, okay.
so that's gonna make it a little bit more difficult. So that because what Donald Trump wants is to bring
Ah,
everything back
so
home,
your
right?
your theory is that it's actually an interesting one. I never heard it.
Yeah.
Your theory is
So what?
that the FDA, because now they're under RFK, they're going to change the guidelines to where outsourcing is frowned upon more or less, like global outsourcing.
Exactly. So they're gonna have a better, because they want also to
Haven't
get
heard that
data
theory.
that is that the data needs to be more clean. That's the intention of improving all the processes, right? So I think the pharmaceuticals are still going to be doing part outsource outside United States, but then the quality of the data that they need to provide is gonna be a lot more clean, a
Well,
lot more
yeah.
regulated.
I actually haven't
Um,
thought of this theory, but I don't even think they need to use the justification of more clean data. I actually think they just need to use the justification of we are nationalistic now and we're in a new order of protected trade and self-dependence, and that's all you really need for that to happen. But you risk selling the drugs in overseas, right? Or like Takeda. What are some of the big European ones? Novo Nordisk, Takeda from Japan, Otsuka, AstraZeneca. Those are big Sanofi. Those are big manufacturers. So I think they're going to make U.S. divisions, which they already have. And then the ours here, like Lilly, are going to make European divisions if it makes sense to sell
yes.
there.
So what I think is going to happen is obviously the guidelines or the regulations, the FDA, even that the FDA is now political, they are going to make the regulations or the guidelines a lot more stricter, so that way um, the business is still here for the pharmaceutical companies that are American, right? And if you think about it, I think it's between 40 to 60% of the pharmaceutical companies are American, right? We're one of the largest um, exporters of medication. Now, if the companies that are from overseas that want to get the drug approved here, they will still need to do the studies here, right? Because otherwise they are not going to get it approved. So part of those studies I'm not gonna say all phases, but at
Yeah.
least phase part of phase 2 and 3 are gonna be
Well,
have to be done here.
that
So
is
I don't.
congruent with Eli Lilly. Even before the tariff came out, they announced they're building a huge $500 billion plant, manufacturing plant in the United States. So they're with the new to work with the new administration and be more aligned with their America First goals. So this is actually an interesting theory. We'll see if it plays
Yeah.
out. So you're actually bullish on these moves when everyone's afraid. You're actually thinking this actually is a good thing for the industry, perhaps.
Yeah, because I mean, what's the biggest market, largest? I mean, just talking about purely business. We're not talking about everything else but business. If you think about the largest consumers of medication in the world, is
Yeah.
United States again,
And the biggest
right?
buyers of
So,
anything in the world
so,
is the United
so
States.
we're going to have to adjust to whatever market trends we have right now. And if the guidelines are stricter, they're gonna have to they have to play along, right? FDA is FDA, whether we like it or not. And now it's passing through a transformation, and it's passing through um, kind of a new beginning in everything, right?
Well, the
So
Singapore Prime Minister came out and said we are now in a new world order of isolationism. And so this is, I haven't thought about that aspect like you just brought up. I actually think it's worth considering. I don't know if it's true. I haven't thought about it that much, but it's definitely a possibility. It would require the FDA to be in alignment with the administration, and they are because HHS is in charge of it, which is RFK. Yeah,
and then it's gonna be also like a situation in which the pharmaceutical companies that are exporting
yeah,
products to other countries, now if the tariffs are lower, it will compensate with what they are paying for the supplies that are bringing from overseas. So
yeah. If you want to, if you're a foreign manufacturer and you want to sell your drugs in the United States, they have guidelines already for you either do the studies here or in selected approved countries. So what you're essentially saying is those selected approved countries will be gone or maybe modified, and it will basically be US.
kind of, I think it's gonna be a mix of like a part of the some phases that, for example, phase 1, I think is gonna be done more outside because it's a smaller studies, more is much easier to have control over
What if they go
the
even more?
regulations.
What if they go a step further? I mean, it's in theory, it's possible. All your data has to come from US if you want to sell here. If this war, this trade war goes too far, that's the isolationism that it will bring. And those manufacturers are gonna have to do the studies, all of the studies here, right? It's interesting. I have not thought about it. I gotta give you credit on this story because it's an angle that we haven't considered. I haven't considered.
I mean, if thinking about the politics or the all the frame that the president has put, that's why I just thought about that situation, right?
Yeah, yeah.
And now, but that doesn't mean that here the guidelines are not gonna be stricter. It's gonna be stricter, and it's gonna be more. I think it's gonna require more from the sites. That the sites needs to be more efficient, and the sites are going to be more careful with the selection of the sites, because if the guidelines are going to be stricter for outside, I'm sure it's going to be stricter inside too. So the
Yeah.
sponsors and the CROs and everybody has to be adjusting to the new regulations or the
I
stricter
just
regulations, um, and that's gonna naturally shake that part, and we're gonna have to be more efficient on what we do. I think that's actually going to push more efficiency on the industry, and it's gonna make us think to improve really, and not
yeah.
to keep on the status quo that we have been for many years. So that's what I think is gonna happen.
Well, I fear, okay, isolationism doesn't work for a reason. Free trade, I'm a proponent of free trade. You can argue what we currently have is not free trade. That's why I'm not against the idea of tariffs, but I'm against this version of it because this is nuclear, which with no end in sight. I fear, and Darshan shares the same fear that drug prices are going to get too high because of this. Because the next thing after tariffs, they're saying because drugs are not in the tariff plan. But the next thing after tariffs is going to be drug price scrutiny. And they're going to say Americans need to pay the same amounts that everyone else pays in the world because we're tired of subsidizing the rest of the world's research. It's essentially what the complaints are. So, what that means is it's going to increase drug prices here and everywhere else, or those manufacturers are just not going to want to sell here unless they open up US plants, but prices here are going to get more expensive. It's the same argument of why an iPhone made in the United States is going to cost like $3,000 versus 1,200.
It might, but then if you think about um, that the current president wants to keep us to be the most advanced in many different areas, including pharmaceutical, which we are. I don't think he's gonna be affecting that part because that's against to his political structure that he has right now with everything else. Like for example, even with crypto, he wants to make sure that we are on the top notch and on the most advanced country when it comes to crypto, when it comes to technology. Why he will be ruining pharmaceutical when we already have it? I don't think
You're
that's
going
gonna
to get a lot of
affect.
haters, Monica. I just want to say people don't hate Monica, right? She's an awesome person.
But why do you think I'm gonna have
Because
haters?
people expect
It's
if
just
you work in this industry, you gotta bash because he's the enemy of the industry.
um,
And they got mad at me when I was okay with Doge, but now they're happy. Those same people are happy with me because I'm not okay with the tariff plan. So it's like,
I'm just like I'm not the kind of person that I don't think about the president as a president. I'm just think about the business perspective. I don't it's just a
right.
point of view. I That's how I analyze it. I don't know if it's gonna
It's an
be the
interesting
way I'm
take.
seeing
It's
it.
an interesting take. I think it will have to have a multi-pronged approach because if you're gonna make pharmaceutical reform, they're gonna have to get rid of the pharmacy benefit managers. In theory, it could work, just like in theory, the NIH could work at not 10%, not 9, 10% capacity, but 50. I think there was waste there. I think 90% reduction was too much. I think I'll end up finding a medium around 40 to 50. And I think you can do a lot with the drug pricing if you get rid of the PBMs and have drug companies negotiate directly with pharmacies. So
I mean,
there's a
I
world
don't
where it happens.
yeah, I don't think, I mean, I don't think that that the plan is completely perfect because there is no perfect plan, but I think it's gonna be convenient in in many ways. If it's obviously
It's
if it
definitely a
if it
hot take.
if it's going to if it's how can I say, if it's applied correctly, right?
Yeah.
The way he's doing it, I'm not a big fan of the way he is happening. However, I think um, we kind of needed a little shake up, as I mentioned, so that way
It's a
we're
lot of
not
shakeup.
anymore. I mean, we're not in a status quo anymore because I feel that for so long we were in a status quo in many things, and the only way to improve is by shaking things up. I'm not political in any way. I don't want people to have a wrong idea. It's just my point of view when it comes to improving processes, to improving everything. I mean, isn't that beautiful if the industry gets better uh, because we actually have to stop being on the status quo,
No, I agree.
and if and if it's convenient for everybody, not just for us working in the industry, but for the end consumers, um, improving the processes, and improving everything is a necessity. If you think about in the past or historically, when the economies have been shake up, is when the largest or the best advances have happened. The best
Yeah.
companies have grown from this.
And to bring
So
it to
that's
an
what I think
individual
is
level,
happening.
and to bring it to an individual level, because ultimately that's all we can control is ourselves and our own businesses. The greatest opportunities usually come from crisis. So I know it sucks like the NIH thing. A lot of people lost their jobs. I bet you, and not everyone, and I don't think most either, but I think most will bounce back with something. I think there will be some that will look back 5 years from now and say that was the best thing that could happen to me
That happened
because,
to me.
and you've seen this over and over. I've had the on my show before in the past. It wasn't from the NIH, but similar situation. I got laid off. I opened a site. Ultimately, it's the best thing. No
The best
looking
thing that
back.
happened.
Yep.
So, and all that people that are right now without a job, unfortunately, right? And that's probably the thing that that makes me think every day, what can we do to help people, right? What can we do to assist as many people as we can? As I mentioned to you, I have been thinking about it. There is something that we need going to be able to do, um, but in that situation, um, that's when we become more resourceful and the best ideas come out.
Yeah. Out of
Unfortunately,
necessity.
that's our
Necessity is the
human
mother of innovation. So,
that's our human way to flourish, like the coffee flourish when the water is boiling, right?
yep.
So I try to look always on the silver lining of
And that
things,
is a
and you know
silver
that.
lining I have not considered. That is a theory that I have not heard, which is actually very interesting. And I'll be thinking about it a lot more now. And the answer is who knows? All we're left with, because
Exactly.
this
Hmm.
great communicator of a president is not communicating at all, other than hyperbole. And so we don't know what the objective actually is, right? Other than hyperbole, make America great again, make the middle class great again. But what does that actually mean? Like how much tariffs is enough for that to occur? The market doesn't know, and that's why you're seeing blood in the streets. I've been buying up more of my stock, AQST, because it's cheap as fuck. They're gonna have a FDA approval, hopefully, in January. I'm almost convinced. And so to me, the fundamentals don't make sense for that to be so cheap, so I just keep buying more. I could be very wrong. Maybe Trump gets rid of the FDA reviewers by then. I don't know. A lot can happen, but this is why things are getting so cheap now on the stock market, and this is why there's so much uncertainty. So I think Trump could do a much better job of communicating. I think he's demonstrated he can communicate well during the election with podcasts and jumping on everyone's podcast. But now when kind of people need him the most, you're just getting like 10-minute sound bites from Air Force One, where it's like hyperbole and like kind of bully tactics. Like it's not really
Yeah,
objectionable.
I think that's intentional, Dan,
Sure, but
because
it's causing chaos to
that's
people that don't
that's
didn't vote
exactly
for that.
what I think. That's exactly what he's looking for. So that way, when the markets um, turn around, it's gonna be even more more
Sure, sure,
dramatic
sure.
the results, right? I mean, again, just analyzing historically and thinking about his previous term, how it was, and his public behavior in the past, right? That's how I came up with these crazy ideas.
Well, your theory is
Uh,
crazy. It is crazy.
but I think one thing that for sure this is only assumptions, obviously, right? We're not experts, but the only thing that I know for sure is going to happen is that this is going to lead to improvements, at least when it comes to the industry
I
because
hope so.
they, if you
Because the
think about
majority
it,
disagree with you on that statement right now.
well,
I'd
um,
I'd like to see the silver lining. But I'm telling you, the majority of the people in our industry, with what you just said, disagree.
what you know why I think this is gonna lead to innovation or to improvement? Because I mean, I come from a third world country, right? And in countries where you don't have all the resources available, you become resourceful. And when the economy is like that, and we face like a dead ends, or we face difficulties with the financials, we become resourceful. And the best way to improve and to make things work is through innovation,
Of
or to bring in,
course.
or making things better. No,
But don't tell me the US is going to become a third world country first for that
no,
to
no,
happen
no,
here.
no, 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 no.
Because
I'm
now I'm ready
mentioning
to sell my
that.
stocks after what Monica just
No,
told me.
I don't think that. I don't think that's going to happen. I'm just comparing it because when you are, I mean, in Latin America, you're always trying to be resourceful with what you
Yeah,
have.
of course.
So that's what I'm saying is the situation when the economy is like that,
It
you
brings
become more
creativity.
resourceful.
Yeah.
Exactly.
Constraints lead
So
to
exactly.
creativity, constraints lead to innovation. We don't want too much constraints at the same time because we depend on, for example, in our industry, steady, predictable investment every year in new studies. I mean, there's a whole ecosystem around this. And if you just pull the plug on that and
Exactly.
say, hey, it's over because I think it's not going well, you're scaring the shit out of everybody, including myself. I'm less afraid than majority, but it sounds like I'm not as optimistic as you are on this, and I hope you're right.
I mean, maybe I'm in La La Land right now with that,
Well, then I want to join you
but
there.
but I think in situations like this is when the best ideas come up.
Yeah.
And that's historically, that's not something that I'm making up, it's just the truth.
Yeah, that's
so
facts.
so so I'm sure it's going to improve somehow the industry. And we need to stop that status quo. This is the time to improve. And if even pharmaceutical companies, if they want to make things lower cost, or if they want to lower the investment and to make the to allocate the resources better, they are going to work on technology to improve and innovate the processes. um,
Well,
and that's just something that I think is going to happen.
I hope you're right. I know you're right. I'll rephrase it. I know that it's eventually the outcome. I just don't know what path it's gonna take to get there. That's the part that scares me because we're planning for a certain level of growth every year with all of our businesses, all of our careers, and for that to be, I mean, they're already were messing with it a little with the NIH stuff. Like, there's an argument to be made for how that's bad for our industry too. I don't agree with that, but I could be wrong. But if you throw in on top of that uncertainty, this nuclear version, where it's just all industries and then pharmaceuticals are next, because he said that, you just lining up like the perfect storm of uncertainty to where, yeah, we got something coming on the other side, but what does it cost to get there? And it's like, I don't know. I don't want to
That's
find
a
out.
that's actually a perfect opportunity to be creative and build a great
Well,
business.
yeah, out of this is gonna come some great businesses, just like out of COVID came some really good ones. AI kind of, the commercialization of AI kind of came out of that. Work from home came out of that. So, what's going to come out of this, which I don't even know if it has a name yet, and we don't even know if it's a thing yet. It could just be a few days and then it's over.
Okay, so what do you think is going to happen, or how you see it? What will be the scenario that you have in your mind?
I have two different scenarios that are different, and I don't know which one actually is more favorable. Which probable. I really don't. I've been thinking about this. One is the one I kind of illustrated, where things just get really bad for like a year. There's no investment in any industry, stagnation, stagflation. It would suck
Hmm.
for all of
That will
us.
be the worst
That's one
thing that could
option.
happen. Yeah.
The other
Hmm.
option is this negotiations actually work, and in a week, the majority of countries reach a deal with us, and maybe China won't, and that's okay. We'll have like a Cold War with China, which has its own problems, but it's not a catastrophe. As opposed to right now, it seems like it's the United States versus everyone, right? And
Well, we're in the middle of the storm right now. I totally
yes,
agree with you. I actually think his negotiation ways is obviously he put the tariffs in a way that is it doesn't seem to be, I mean, equal until you learn how they developed those numbers, which it was is they actually released the equation that they used to come up with those numbers. But at the same time, I think it's his way to negotiate. He always goes to the higher and then start negotiating down there, down and if you think about internationally, is convenient for the countries to negotiate as fast as possible. Otherwise, their own economies are going to deteriorate as fast as possible too, including ours. So we at the end of the day, the whole world right now is in the same boat. Just like as we happen that it happens when we were in the during the pandemic.
fair enough. You have to look at also the rate of change, not just the current snapshot of GDP and purchasing power. You have to look at the rate of change of future potential. And if you look at that, particularly from a STEM, so science, technology, engineering, math, the United States is at a decline as
Hmm.
far as earning potential in those
Yes,
areas because of stupid woke policies like getting rid of AP calculus and teaching kids that it's racist to get an A in math, whereas India and China and the rest, if you look at their rate of change, like we're talking calculus now, that's increasing. So if you take the long road, which is even scarier. Yes, we are at the center of it. We are the global leader. We are the purchasing power. We have the world reserve currency. But if you let it play out 20 years from now, and China has problems of its own. China also has a horrible birth rate,
demographic. Yeah.
worse
Hmm.
than the US. India, however, is on the rise, and a
Hmm.
lot of the innovation in the US comes from immigrants from India.
Hmm.
And so there's a world where they become the leader because the rate of change is
Yeah, of course.
accelerating.
I mean, yeah, no, totally. I mean, obviously, that's the nature of the economy in the world, right? Like 100 years ago, it was UK. We cannot be forever on the top. I mean, we can still be a strong economy, but naturally, somebody else is gonna be the leader unless there is a currency that is neutral.
Ah,
And
you're
we
talking
have
about
that
Bitcoin.
technology right now. Yeah, we have that technology right now. So we don't know what's going to happen really because mm, all the technology that we have right now is for the first time in history, we have so much technology at the same time that who knows how things are going to evolve.
Well,
I mean, obviously, reading the history and reading Ray Dalio's book,
listen,
it just put things in perspective when it comes to that. But
I'm I'm gonna
I don't
send
know.
you this. Have you read this? If not, I'm gonna go to UPS store and send it to you tomorrow. The Sovereign Individual. This book was written in the 90s, and it's basically talks about what's happening now, minus the tariffs. It's talking about nationalism, reaction, technologists, the revolt against technology. You're gonna have two camps. This is saying the end of the global superpower and the beginning of sovereign individuals. And this book predicted Bitcoin. Well, I take it you didn't read this. So I'm gonna send this to you. Do you have this book?
No, I
All right, I'm
don't.
gonna send it to you tomorrow. I will I will send it to you. You'll love this. I got it on every form. Kindle, audio, paperback.
Wow.
This is like my
So
fourth
so
copy I gave away.
explain me. Well, explain me something. Explain it to me, Dan.
Well, I wrote an article on it, but essentially these guys were are historians. They advocated for this, or they wrote this in the 90s, 1997. And then they wrote a book before this that kind of paved the way for this. But this is the sovereign individual, so it's no longer about what country. Countries exist because they protect you, the individual, from foreign invaders. And then they help create an ecosystem where you can live a free life or like the best life you can. That's capitalism, more or less, free countries. There's also like the economies or the countries that you can't choose, like China. It's mandated, it's forced. But the majority has been capitalism. And then capitalism turns into this imperialistic thing of let's keep expanding into other territories. But now there's no need for that anymore because of trade deficit. So it's related to Ray Dalio's book too, Changing World Order. Those are like similar, but this is more about the individual and how after this crisis, whatever it is, maybe it's this that we're in right now, there's going to be a change in the world order where it won't matter because of things like crypto. You will have like nation state like they used to have in the Middle Ages, where you would have a lord of a domain, so like it could be a small business, and you would have people working for that lord. That lord would pay taxes to the nation state, like the city, maybe the city of Yuma, but I wouldn't pay taxes to the US because there's no need for it. And Yuma's going to kind of protect my interests here. There's not going to be a need for violence because there's no more need for expansionism because everything's done digitally, right? So there's going to be a need for like cyber protection, but not like physical invasions and things like that. So it's really good, and it talks about how to transition to the information age. But if you think about when it was written in the late 90s, and it's like talking about everything that happened today, and they predicted Bitcoin in here before it was even a thing. It's a must read book. So
Wow,
I'll
very
send this to you.
interesting.
I'll send this one to you tomorrow.
Okay, very interesting. I mean, what can we say? Everybody is scared in different ways, and obviously that comes with change,
Hmm.
and the only way for us to cope with this is just start adapting slowly but surely. I mean, what can we do? If everything is changing, if everything is evolving, and now we're getting a shake up, we just need to evolve and adapt and become better.
Transition to the information age. For those that want to read the article I wrote about sovereign individual on LinkedIn, I'll put the links underneath this video, or if you're listening in the podcast, I'll put the links underneath this show notes. And then a link, of course, to Monica's profile where she will gain many followers because of this, her appearance on
I
this.
will welcome everybody that wants to be in La La Land with me.
There's a lot. You know what? There's a lot, but the majority are very angry right now with anything having to do with Trump. I'm somewhere, I have mixed emotions about it. And then there's others that are, very happy with what.
I just try not to, like I was mentioning, I just try not to make myself involved so much with all the negative outside. Obviously, I understand it will affect me in somehow, but if I am in a good place mentally, I will be able to manage better the negativity that is, or all the craziness outside, than if I am in a bad place mentally. So I am like the bisons when they go through the to the storms. I just pass the storm um, as fast as possible rather than staying sitting and waiting for that to affect me like the cows. Right. So I think being in a mental in a better mental health state and not getting yourself contaminated. Obviously, like I say, It's hard when everything is screaming so loud, but that's I think that's the best way to self protection. So that way you don't get affected. And like I was mentioning, I try to look at the silver lining of everything, even in situations as bad as difficult as like we are passing through right now.
I like the silver lining outlook, and it's honestly something I haven't considered. Of maybe that's going to be the FDA's only choice is to adapt to. I mean, they've had enough resignations from there and layoffs to where, or firings is a better way to put it, to where they're going to be more aligned with the current administration, and maybe they'll be on the same page. I think if there's needs to be a silver lining, that's what it's gonna be. But the path to get there, I don't know. Hopefully this resolves quick and this video is not evergreen. And if it doesn't, chances are we're struggling right now, and this book becomes even more
Well,
important. The
let,
sovereign
let, let, let,
individual.
let's think about the big picture and all the spot in it.
Well, kind of hard for a lot of people right now. So I appreciate it, you coming on. This is and having the hot take that we needed because I'm tired of listening to the same old stuff on LinkedIn and YouTube in our industry. At least you have some real opinion and a thesis that I haven't heard. So it's commendable. And go follow Monica. Don't unfollow her. Follow her. Like,
Okay.
subscribe, comment, share. Go connect with Monica right now.